everyone, this is Dr. Ballerman again. We're talking today about longevity and the aging process and how we kind of counteract that accelerated aging that a lot of us are going through at this time. So the latest research in longevity is really talking more and more about what we call polyvagal theory or polyvagal syndrome. The vagus nerve is the longest cranial nerve. It impacts every organ system in our bodies. And what we're finding is this nerve has two branches. One branch controls our fight or flight, or fighting the war, kind of like, the world is scary. And then the other side is the resting, the restoring, and actually our anti-aging. And the two sides cannot fire at the same time. So we can only be either fighting the war or we can be healing, but we can't do both at the same time. And unfortunately, at this time where we don't feel safe, we don't feel like we have a place of safety in our bodies or in our world, there's so many threats going on so many levels. A lot of people are so caught on the side of fighting the war, of being caught in the fight, flight, freeze, fear side of the vagus nerve, that to actually relax feels threatening. To feel like we need to heal our bodies feels threatening because we just don't feel safe enough. Like putting down those barriers and relaxing feels really threatening. So we want to try to counteract that so that we don't accelerate our aging during this time. And we can allow our bodies to self-heal and self-regulate, which is what they're designed to do. So some tips and tricks on how to turn off that fight or flight fear response, recognize it, and feel safe in our bodies. So first thing is creating a somatic sense of safety. One trick is to look at your hand and just acknowledge that your hand is safe. Just looking at the hand and saying out loud, if it helps, just my hand is safe. There are no threats to my hand. My hand is completely safe in this moment. Feeling that sense of safety and that conscious awareness that there are no threats right now can bring a sense of safety into our self, into our body. So we can start with something small, really focus in, and then we can bring that in. So that can be one tip for doing that. Another tip for doing this process of resetting the vagus nerve is that we need to recognize that we have a culture of sucking in our gut, and kind of everybody has to have a flat belly, and we're supposed to have a tight core, and so we suck in our gut, which pinches the vagus nerve and forces us into that fight or flight side. So we want to reverse that process. We want to relax the belly, but we don't want to just kind of collapse, right? We want to do this with an intention of healing our body. So we want to start by putting one hand on your chest and one hand on your lower belly, and just start by breathing into your belly so that you can feel that lower belly moving, and also making sure that that one on your chest is staying still. So belly is moving. When we do this belly breath, we actually bring blood supply back to our intestines. There are more nerves and hormones related to well-being in your gut than there are in your brain. So we want to bring that blood supply back to those internal organs, relaxing the muscles around those internal organs, and really bringing in that pulsing of the breath will nourish that. It's kind of like giving yourself a bath on the inside, where you're letting that blood flow come and go, and you're just releasing and relaxing and letting that gut come back into health. So a lot of gut issues for people are because of that constriction of blood flow and not really letting the body self-heal, self-regulate, and come to a balance of peace. So that's the first step. bringing that breath into the front of the belly. The second step we're going to do is we're going to bring the breath into the sides of the belly, because when we bring the breath into the sides of the belly, we increase the blood flow to the liver and the spleen. So when we don't have enough blood flow in the liver, we get grumpy. When we don't have enough blood flow in the spleen, we start to feel like we don't have a self-worth, we don't have a place of worth in life. So we want to bring that breath out into the sides. And again, you're going to place your hands on the outer sides of your ribs and the outer sides of your belly so that you can feel that belly move with your breath, and you're going to keep that breath pulsing into the sides of your breath so that you're again pulsing that blood, bringing that blood into not only the front but also the sides. We want this to be easy. If it's not easy, we won't do it, so we're going to try to do this with as much ease and relaxation as possible. The last place we're going to bring our breath is into our back, because if we bring breath into our back, we bring breath into our kidneys, and we actually increase our lung capacity if we bring that breath up our back and up through the back side of our body instead of through the front side of our body. We actually expand the breath into the lungs to their fullest capacity when we bring it into the back. So placing one hand on the belly in the front, one hand on the back, and just expanding into the back so that you feel that breath coming in and out of your body. So doing this kind of breath work can be really important. The reason we're doing it is we want to relax the whole diaphragm. So how breath comes into our body is that we contract our diaphragm to bring it in, and then we just relax our diaphragm to let it go. So we do want to relax the whole diaphragm so the vagus nerve releases. Another tip for releasing the vagus nerve is doing cobra pose. If you're not familiar with yoga, you can Google cobra pose, but the basics, you're going to lay on the floor on your belly. You're going to keep your hips on the floor, and you're going to arch up from your hips. So you're just going to push the floor away with your hands so that you're bringing your back into an arch form. Now, to do that comfortably, we really need to release the back, and we need to release the pelvis, because when we suck in our gut and we tighten our core, we lock our pelvis and we lock our thoracic spine. When we do that, that's one of the earliest signs of early aging, is having this immobility of the thoracic spine. So our ribs get really rigid and we get this kind of puffed up pigeon kind of a appearance. We get this kind of coming at the world with a puffed up chest. So we want to release that. So one of the tips is to sit on the edge of a chair with your feet on the floor, and you're going to imagine that you're sitting on the face of a clock. The 6 o'clock is in front, the 12 o'clock is behind. As you breathe into your belly, you're going to rock gently out to 6 o'clock. As you exhale, you're going to come back gently to 12 o'clock. You're going to start really tiny because your pelvis may be kind of locked. So you want to make sure that you're not overdoing it. Again, relaxation. Doing things at 70% capacity will give you a greater capacity to get to 100%. If you do 70% capacity consistently, 100% is easy. If you're constantly trying to push to 100%, you actually diminish your capacity to get to 100%. So we want to do the 70%. We want to just kind of do this little bit of motion at first and then allow our body to relax into it so we can get further and further. So as we start to expand that motion, then it starts to expand through the spine. So we start to feel the lower back starting to open and move a little bit with the pelvis. Then we start to feel the thoracic spine, the upper back, starting to expand and open. So that eventually, as you move your pelvis, your spine moves and your head moves. So you get this movement through your spine. So we want to be able to loosen that spine so that when we do cobra, we're able to actually move the spine. If the spine's really rigid and we try to bend it at a 90-degree angle, we get a lot of contraction and pain in that lower back. So we want to make sure we're releasing the back so that we can open up into cobra. One of the unique things about cobra is that if we keep our toes active, we're pushing through the bottoms of our feet, we're pressing up through our hands, we're stretching the whole vagus nerve. And as we stretch that vagus nerve, if we hold it long enough, our body will actually start to shake violently sometimes, and it feels kind of threatening, but actually you just kind of let it just do it, shake it, and as soon as those shakes stop, you've actually done a full vagus nerve reset. So congratulations, your vagus nerve is now in the healing, resting, and restoring. But that can take 20 to 30 minutes of sitting in that cobra pose. So that's a really long time. Listen to your body, listen to you, know what's right for you so that you're not pushing yourself too far, okay? So if that's too much, then we do the cobra pose. Then from that same place, keeping feet and hands exactly the same place, we're just gonna pick our bum up like a little mountain towards the sky. That's called downward dog or mountain pose. We're gonna have that pull up, and then we're just gonna bend our knees and fold our body and rest our head on the floor, rest the body on the upper legs, and the lower legs are folded under. So we're just called child's pose. We're just gonna let our body come to that resting point. Doing those 3 yoga poses together will reset the vagus nerve very nicely. So those are great to do right before bed or right when you're getting ready for sleep. You can do that reset. So that's about the yoga part. One of the other things that I want you to be aware of right now is we have this intensity of relationships. We're spending a lot more time in our relationships. Sometimes it's a little too much time in our relationships. It can be really difficult. Sometimes that tension of relationships can be heightened right now because we don't have the distractions of our normal lives. So we want to make sure we're aware of the differences between men and women, because men and women deal with stress very differently on a physiological level in our bodies. So when women get stressed, they build up way too much testosterone and they burn out all their oxytocin. Oxytocin is kind of their connection hormone, and testosterone, as we know, is that go, go, go hormone, right? But with men, what happens is they deplete all of their testosterone and they build up too much oxytocin. So it's kind of ironic, but we do process it very differently. So a lot of times what happens is women get stressed and they come home and they're just like, I'm so stressed out. And their loving spouse wants to solve the problem for them. They're like, well, you could do this, or you could do that, or this could be the solution. And it makes them more grumpy because solving problems builds more testosterone. So they're like, I don't want any more testosterone. Please don't give me any more testosterone. Just let me get some of this testosterone out. But that can sometimes, just knowing that can sometimes help, because we just know that it's not actually a personal thing. It's just too much testosterone, not enough oxytocin. So for women to build more oxytocin in their bodies, they're going to take 2 fingers, starting down at the lower abdomen. They're just going to inhale, drawing the fingers up the middle of the body, and then exhale, coming down the sides. Inhaling up, exhaling down. Just drawing little hearts, inhaling up, exhaling down. That'll build some oxytocin. Other things that build oxytocin are holding hands, sitting close to each other with skin-to-skin contact, sometimes just silently sitting together with that physical contact can do more to heal us than anything else. So sometimes we just need to have that ability. But we have to remember that if our guys are stressed out and we're holding hands and touching skin to skin, they're gonna build more oxytocin, and that might not feel so great for them, right? So it feels great for the woman, not so great for the guy. So for guys to build some more testosterone in their body, they're gonna take their hands, they're gonna place the hand under the cheekbone, thumbs on the temples, fingers on the hairline. This is not an aggressive squeeze your head. This is a gentle pressure on the bottoms of the cheekbones, a gentle pressure into the temples, and a gentle pressure at the hairline, and breathe. And just breathing this way will build testosterone in their bodies, and they can help to bring their body back into balance. So this is a great thing for guys to do when they are feeling a bit stressed out and not so balanced, maybe a little fatigued. That holding the head in that way can be really helpful for both men and women in stressful times. Taking the left hand behind the head, right hand to the top of the head. So we're just placing our hands back of the head, front of the head, and we're just closing the eyes gently and breathing. When we do this posture, we're actually, when we put our hands somewhere, we actually bring blood flow to that area. So sometimes when we're too stressed, we don't have enough blood flow in the front of our brain where we make good logical decisions. We've kind of shifted into the emotional center and out of the logical center. So placing the hands on the back of the head and the front of the head will rebalance the blood flow in the brain and just allow you to take a couple of deep breaths, bringing your brain back into balance, which can be very helpful. These are easy things to do if you want to run off to the restroom and have a quiet moment by yourself when you're just feeling a little stressed out. I've mentioned before the looking up to the side. That's a great one as well. One of the things it does is stretch the vagus nerve as it crosses the carotid body. And when we fix our eyes on one point above our heads, we stop the vagus nerve from firing in the fight or flight response. So those can be great tips as well. We've talked about those in other videos, so we won't go into that too much. The last thing we want to talk about with longevity is oral health. So clenching actually is a symptom of this polyvagal syndrome, of getting stuck in the fight or flight. We tend to clench into our teeth. So I talk a lot about clenching with all my patients. They tell me, I don't clench, doc, and I see all the evidence there. They've got the big masseter muscles. Maybe they've got big cheeks where their cheek muscles are just super strong. And their teeth are chipped and worn and flat. Or they're swallowing in ways that are like, oh, it's a strain, right? Or they have scallops on the sides of their tongue, or they've got white lines on the insides of their cheeks. Lots of signs of clenching in my practice. So knowing that that's a sign of just having too much stress in our lives, not really being able to self-heal, really, if we approach it from that kind, gentle place to ourselves of just saying, my world is pretty big, it's pretty stressful, there's a lot going on, I can still be resilient. So using those tools to bring that resilience back into yourself, using those tools to be kind and gentle and forgiving to yourself, okay? So we're not trying to beat ourselves up or criticize, we're just saying, you know what? This is the world we live in. These are some tips and tricks for making it easier, okay? So the last thing I want to talk to you about today is the oral bacteria. So we're finding more and more about micronutrients that are absorbed in the mouth before they hit the gut. A lot of things are actually digested in the mouth. Carbohydrates, for example, need to be digested in the mouth. Once they hit the gut, we really don't get a lot of nutrition from them. Proteins need to be digested in the gut, but they have to be in a small enough, mushed up enough form that our body can actually digest them. Because if they come in chunks, they start to ferment, we get acid reflux, things don't do so well. So slowing down, chewing more, taking some time to really embrace this process of eating, this nourishment of ourselves can really help. Our attitude with what we're bringing in has more to do with our well-being than what we bring in. We want to eat a balanced diet. We don't want to eat all Skittles and Oreos, But we do want to bring in blueberries and kales and citrus and fruits, and we want a balance of things in our diet. We need a good balance of protein and carbohydrate, and we want to have things in balance. Certainly a lot of diets these days are a little out of balance. I'm not a huge proponent of that. I think we need to have things in balance. I think anything in too much of an extreme isn't super healthy. But some of the things we're learning about being able to absorb those nutrients in our mouth is that the mouth actually has to be healthy. The bacteria of the mouth have to be healthy. And if our mouth gets out of balance, we can't absorb the micronutrients as well. And one of those out of balances is acidity. So if our mouth gets really acidic, which starts to taste sour, kind of tastes not so great, metallic-y sometimes. Our breath is not so great because it smells kind of sour. That's a sign of too much stress in the body. The body's getting really acidic, mouth is getting more acidic, more risk of cavities, more risk of gum disease, not absorbing enough nutrition. Slowing down, bringing our body into a better chewing cycle is one. Breath work is another. Help to rebalance the body. A lot of research is showing breathing through the nose really brings our pH in our body back to a more neutral or a little bit basic pH, which is helpful for bringing the saliva to a neutral or basic pH. But also using pH buffering products that can help bring up the pH. I've been a proponent of baking soda for years. I definitely think that can be helpful. Some products on the market have calcium carbonate instead of sodium bicarbonate. That can help too, because we can bring that calcium back to the teeth and remineralize the teeth a little bit. But kind of doing some pH buffering in our mouth can actually kind of help our mouth be healthier. Bring up that resistance so that we are less susceptible to cavities, gum disease, and we have more ability to bring in those micronutrients. So I hope you've enjoyed the information today. Please be well, take good care of yourself, and remember to breathe.